All right, friends, chapter 13, sexual disorders and gender variations. Um, this is some super fascinating stuff. It's perhaps a little bit awkward as we're going to be talking pretty explicitly about sexual function, um, but we'll try and keep it as clinical and blush as you need to. But this is important stuff as we're understanding some of the disorders that people struggle with and deal with on an everyday basis. Now, there are a variety of different kinds. We're going to talk first about sexual disorders. Um, a variety of different kinds of sexual disorders in terms of sexual function, right? In order to understand the different disorders, we need to understand the human sexual response cycle, where you've got the four phases of desire, excitement, orgasm, and resolution. And you can get disorders based on any one of the first three there. We don't really deal with that last one in terms of disorders because physiologically it is so vanishingly rare for somebody to be unable to cool down, so to speak, after sexual activity. That I mean, not that it's impossible, but that's far more of a medical condition, not necessarily a psychological one. And so the body mostly just does what it's supposed to there. Okay, so we're going to talk about different disorders as they impact different ones of these first three phases, right? But first, it's worth looking at the actual sexual response for men versus women, right? And this is something that's been studied extensively over the last 50 years, 75 years or so, once that became a little bit less taboo, and we could say, okay, this is actually something that we want to research and not just leave in the dark, so to speak. Um, Unsurprisingly, this graph is much simpler for men than it is for women. Um, and tends to move in a much more reliable fashion for men than it does for women, where there's actually a couple of different options there moving through the sexual response cycle for women, where still the usual response is moving from desire to excitement to orgasm to resolution. But then there's also other options in there as well, where you'll get some individuals who will be orgasming more than once, others who will not orgasm at all, and then move through a resolution phase without orgasm. And there can be, once again, physical and psychological reasons for that. But it seems to be a slightly more complex process, so to speak, for women that has a few more options to it. Okay, so let's talk about the disorders that stem from the first phase, the desire phase. If we're defining what this desire phase is, this is simply, I want to have sex, right? That's the thought, that's the physical response. This is the first move, both cognitively and physically, towards sexual activity. Hey, I am in a scenario where sex is a possibility. Let's start thinking in that direction, right? So this is thinking about sex, having the urge to have sex, being attracted to others. We've got two different disorders that stem from this desire phase. That's male hypoactive sexual desire disorder and female sexual interest / arousal disorder. So let's talk about those. If we're trying to define what they are, for the male hypoactive disorder, for at least 6 months, you've got somebody who experiences very little sexual desire, thoughts, or fantasies. And importantly, the person needs to be experiencing distress from this, right? You've got folks who simply don't think much about sex and don't care about sex, and it doesn't bug them, right? They're fine with that. Like, I just don't deal with that part of life. I mean, whether that's someone who identifies as asexual or simply they're moving through a phase of their life where it's like, that is simply not important to me right now. If there's no distress, there's no disorder. But in the presence of distress and a total absence or near absence of sexual desire, that's something that becomes diagnosable. Now, on the female side, female sexual interest disorder, you've got similarly someone for at least 6 months displaying very little to no sexual interest or arousal. And you need to be missing either your sexual interest or fantasies or receptiveness to sex or excitement when trying to engage in sex. Or responsiveness to sexual cues, or a lack of physical sensation in the genitals during sex, right? So if you've got at least 3 of those in terms of a reduction or total absence, then and once again, distress needs to be involved. If you're not interested in sex and there's problems with having sex, then and you're bothered by that, then that's something that can be treated. Now, as to why these happen, given that they're fairly similar, we do break them out by male versus female because, once again, there are differences in the sexual response curve and differences both in socialization and in biology for males versus females that make them worth categorizing on their own. Now, what causes low desire? Hormonal levels, from the biological perspective, are going to be your first line of questioning. Low levels of testosterone, both for men and women, are strongly associated with lack of desire. These folks tend to have high levels of prolactin and can vary in their level of estrogen. They tend to have overly high levels of both serotonin and dopamine, high levels of activity in both of those neurotransmitter in their brain. And then, of course, you can have some other physical things that interfere with sexual desire, whether it's medication that you're taking or if there's a long-term illness, right? If you're super sick, your body is unlikely to respond to want to expend the energy for sex, right? Because it's trying to conserve its resources to deal with the illness or the injury. Okay. Now we've got the same one here coming up for males. Again, I apologize if this is embarrassing, but just in case there's folks who don't really know how this works and have not had these clear conversations with other individuals in your life, whether it was parents or whoever else, it's worth taking a look at the anatomy that we're dealing with here, right? Where and how that is affected by sexual activity, and what changes occur during sexual activity. So when you're looking on the female end, you do get enlargement of the genitals, both in the labia and in the clitoris, and movement in the uterus as that shifts position, and you begin to get vaginal lubrication as you move through the desire phase and into the excitement phase. And then you get to the orgasm phase, and you get contractions of the uterus and rhythmic contractions of the vaginal canal that are the primary indicators of orgasm for women. And we'll come back to that for men here in just a minute, so that you sort of know what's going on there too. Okay, now when we're talking again about disorders of desire, there can be psychological causes of these desire disorders as well. If you're dealing generally with high levels of anxiety or depression or anger, that can interfere with sexual desire. If you've got memories or fears or even attitudes that are very omnipresent in your mind, that are consuming a lot of your thinking, that you're focused on excessively, that can interfere with sexual desire as well. And there are some psychological disorders that will reduce sexual desire as well. You look on the sociocultural end, what's going on here. There's this is sort of the interactional stuff of sex and of desire. Are you in a problematic relationship? Are you not well matched with your partner in terms of your needs for sex and closeness, or your skills as a lover? That let's point the finger there, shall we? cultural standards can get in the way of desire, right? We have some super problematic uh, cultural double standards when it comes to sexual activity in our culture, where we allow men to be more sexually aggressive and require women to um, shoulder the load in terms of the responsibility for sexual activity. Um, and that disparity can absolutely kill sexual desire, right? So not me, because culturally, once again, as a male, I am unlikely to be expected to do this. But if I were a woman, I can absolutely understand how sexual desire might be impeded by the thought that, hang on, you're just groping at me and I'm the one who has to put on the brakes. And that's unfair, and I don't want to think about this, and screw you, right? Except maybe I should rephrase that. Anyways, you get the idea, right? Some of those things can get in the way. Certainly, if you've got past issues of sexual assault or trauma, that's going to reduce sexual desire in nearly every case. Not every single case, but nearly all. And so these things all can get in the way and be some of the reasons why you get some of these desire disorders. Okay, moving on to the second phase, the excitement phase. This is when you are starting to get some of those physiological changes, like I was pointing out in the female anatomy, and as I'll point out here in the male anatomy here in just a minute. So this is general physiological arousal, right? Increase in heart rate, muscle tension, blood pressure, breathing. You get enlargement of the genitals for both men and women. And if this isn't working right, this phase isn't working right, then you're either dealing with female sexual arousal disorder or male erectile disorder, right? Oh, I guess I don't have, hang on just a second here. I guess I'm missing some slides here in terms of the causes of these disorders. I'm missing those. Okay, well, let's talk about our orgasm disorders. So this is the peak of sexual response, right? The ejaculation of sperm for men, rhythmic contractions for women, the part of sex that everybody's going for, right? Because that's the part that actually feels the best. The disorders that stem from this phase are either premature ejaculation or delayed ejaculation for men, both of those for men, or female orgasmic disorder for women. Now, once again, talking about the anatomy here that we're dealing with, as you move through desire and into the arousal, or I'm sorry, the excitement phase, then you get erection of the penis and elevation of the testes. And as you move to orgasm, then you get contractions of the muscles of the penis and of the urethra that then forces the seminal fluid out. And that's what gives the ejaculation for a man. Now, the symptoms here in terms of these orgasmic disorders, premature ejaculation. This is for at least 6 months. The man ejaculates within a minute of beginning sex, earlier than he wants to, right? I mean, there may be those instances where that's all you had intended, so whatever. But if you are consistently orgasming earlier than you want to, if you desire to continue sexual activity and you go too soon, well then, and once again, there is distress involved here. In that case, you're dealing with this premature ejaculation disorder. You've got as many as high rates as high as 30% worldwide. Once again, not necessarily all at once. This is more like a across the lifespan. You can have individuals who suffer from premature ejaculation during a period of their life and then later don't, because one of some of the things that are most strongly correlated with premature ejaculation disorder are the youth of the individual involved, their inexperience with sexual activity, and the infrequency with which they have sex, right? So if you're a young guy who's not used to having sex and you just aren't used to it yet, and so you're orgasming earlier than you intend, it can be distressing and difficult and can be treated, but also there's the relief of knowing that likely somewhere down the road it will resolve itself. There can be some biological underpinnings here as well in terms of genetic markers that make somebody more predisposed toward premature ejaculation, higher levels of sensitivity in the penis, and differences in serotonin receptors. Okay, delayed ejaculation. This is sort of the opposite problem, where a man is unable to reach orgasm in a reasonable time frame for 6 months or more, and again, there is distress involved. Rates are somewhat lower here, about 10% of men worldwide. And biologically, low testosterone levels will impact this, make this more likely. Head and spinal cord injuries, neurological diseases, and psychologically, there can be some impact too of levels of performance anxiety, like I'm the man. I'm supposed to be the virile one that's initiating sex and completing the sexual act, and I'm not able to. And that's there's the talk about getting stuck in the spectator role, which is involved with high levels of consumption of pornography. If you're used to watching this act rather than being involved in that act, that can have some negative consequences. Someone who masturbates too frequently will sometimes have trouble with delayed ejaculation. And hypoactive sexual desire disorder, right? So going back to that desire disorder, that can impact the orgasm end of it too, as well. Now, for female orgasmic disorder, once again, for at least 6 months, you've got someone who either experiences unacceptable levels of delay in orgasm, or infrequency of orgasm, absence of orgasm, is unable to achieve orgasm in a meaningful and reliable way. And once again, there needs to be distress involved, or else it's not a disorder. There's as much as 1/5 of women in our society who experience this to some degree, and you've got roughly 10% of women in our society who never orgasm. So if you just thought that was you, there's plenty of folks out there. Don't worry. And then you've got another 9% who rarely orgasm, right? So what can cause this? Well, there are a variety of different disorders and diseases and medications that can. Going through menopause can change the physiological response of a woman. Having high levels of depression, existence of trauma, once again, can impact this. And interestingly, looking at the sociocultural stuff, a woman's first experience with intercourse seems to have an outsized effect on how she views sex thereafter, right? If it's a positive experience, then women are much less likely to have a lot of these sexual disorders. If it's a negative experience, which unfortunately it is for a distressingly large number of women, I'd say roughly 1/3 of women have strongly negative first experiences with intercourse. That can have some real long-lasting effects psychologically in terms of how a woman responds. You do also have, moving beyond just the phases of the sexual cycle, there are other sexual dysfunction disorders, disorders where people experience high levels of pain during intercourse. Now, that's not something you generally want, right? That's sort of the opposite of what people are usually hoping for when they engage in sex. So, genitopelvic pain or penetration disorders, these are not necessarily related to which phase of sexual response a person is in, but rather just the discomfort that a person experiences during intercourse. This includes a disorder that you may have heard of before, vaginismus, which is involuntary contractions of the muscles of the outer third of the vagina. It hasn't received a ton of research, but it appears to occur in about 1% of women. And lots of researchers think that it is a learned fear response. So a woman who has had, once again, negative sexual experiences, or has been taught that sex is scary and painful is more likely to experience these symptoms. It is treatable, um, but there can be physical causes as well. Dyspareunia, I think is how you say that, is the physical cause. This is um, severe pain in the vaginal canal. It's usually caused from injuries sustained in childbirth, but can have other causes as well. Okay, I feel like we've talked about most of those, so I think I'll cut us off there.